doctorate in Dendrimer-based drug delivery system from Jaipur, and he is having around more than 14 years of experience in academics and research. He has received fellowship from the Indian Ministry of Human Resource Development, MHRD, India, in 2001 for his undergraduate program and in 2005 for the postgraduate program. He is a life member of SPER, IANN, ASR, AIISSC, member of ACS, ISART, INC, and NPHA. He has published around 62 research and review papers in the peer-reviewed journals and published around 7 books, and 8 book chapters has been written by him. He has guided around 24 pharmacy students, and more than 6 PhD students are currently working under him. Currently, he is working on the dendrimer-based drug delivery system, surface modifications of dendrimers, and polyphenols-loaded nanocarrier for cancer targeting. So we are very pleased to have you, sir, in this session. I first, on behalf of Chamilgiri Institute of Pharmacy, welcome you here. Welcome, sir. And over to you, sir.
Okay, ma'am. Thank you for the nice introduction.
Thank you, sir.
A very warm welcome and good afternoon to all the participants of AICTE-RGPV Joint Teacher Training Program, hosted by Chameli Devi College of Pharmacy. So myself, Dr. Surya Prakash Gautam, working on the capacity of Professor and Principal at City Institute of Pharmaceutical Sciences, Shahpur Campus, Jalandhar. I am here to give a talk on artificial intelligence impact on healthcare and current global transformations. Let's start with the presentation part. So, during the COVID outbreak in 2020, slowly the whole universe was getting towards the lockdown. But exactly the reverse. Digital world was getting unlocked. And believe me that they have unlocked the potential and the opportunities almost in all the fields of related to the human or the mankind. We have entered into the era of artificial intelligence, machine learning, digital learning, Internet of Medical Things, etc. All these terms or the concepts, they are like new normal for us. And they are now the part and parcel of our life. Some examples like Google's next text predictions. People might have noticed that whenever you're writing email in Google or Gmail, they will try to predict the next word using GST3 technical methods. Some speech to text, some Google assistants, chatbots, they are some very familiar examples, and directly or indirectly, artificial intelligence, machine learning, and deep learning, they are playing their role. That will make us to think of that all these concepts, all these parts, they are now the part of our life. And we have to understand that it's like new normals. And this is going to be with us forever. It's worth mentioning that Elon Musk, the founder of SpaceX and electric cars, he has invested around 1 billion in artificial intelligence. The person is the wealthiest person of the planet, as well as he is known to be the future person, future man. He has invested on SpaceX and electric cars some 15 to 20 years back. The person have forecasted a promising future for the artificial intelligence, and next segment he has invested in artificial intelligence. Good or giants like Amazon, Google, IBM, and Microsoft, they are investing in AI and associating with AI-based products. All those make us to think that we have entered into the era where artificial intelligence is going to play a major role and that will benefit the human mankind. Emotional intelligence or the role. Ultimately, AI is progressing like anything. Next level was machine learning. Next level that was deep learning. Next this was data science. And believe me, that upcoming time that will be of the emotional intelligence. In back 2015, robot paper with having the features of emotional intelligence that was sold within 1 minute more than 10,000 units. Artificial intelligence, machine learning, and all those concepts, they are like new normals for the healthcare industry. Niti Aayog, with this initiative on national strategy of artificial intelligence, have made a roadmap for the investment in many of the sectors, especially major contribution to all the healthcare system. Everybody was talking about some infrastructure from the healthcare point of view. But I believe that in this era, we need a more stronger digital infrastructure. And digital infrastructure, facilitating or strengthening the digital infrastructure will make all these AI-based products a reality. Unprecedented growth of FDA-approved products, upcoming startups, and mushrooming growth of AI-assisted healthcare apps will revolutionize the healthcare industry. Just have a glimpse of brief what I'm going to talk in my presentations. First, I will start with some AI, ML, and DL powered transformations in healthcare. Then some top artificial intelligence-based companies in healthcare. 5G and AI-assisted intelligent connectivity, how it's impacting to the healthcare system. Then some telemedicine concept and how telemedicine is helping for the benefit of the human system, human mankind. Some predictive care, the concept of emotional intelligence, some FDA-approved medical devices and algorithms. These products have made the FDA approval process, and many of the products, around 64, they are getting into the market. Startups, some artificial intelligence or the role in clinical trial, or artificial intelligence or machine learning powered health apps or the wearable technologies. So let's start with the one by one. First, just have a glimpse of history of artificial intelligence. In 1950, Alan Turing have given one statement that can machines think, or will it be possible in upcoming future that machines can think? In 1955, McCarthy has coined the term of artificial intelligence. Passing with the time, with 1 decade, computers become faster and affordable. 1980 is considered to be the milestone and the emergence of artificial intelligence. In 2000 around, some AI-based products was hitting the market. No doubt there are some failures, there are some myths as well as merits and demerits. But around 2000, they have established themselves. If I believe artificial intelligence, that's like computers, that deals with computers, the speed of working, how fast they can work. Around 1980, there was a paradigm shift towards machine learning, and the area was flourishing, where the machines or the computers have started to learn and perform. They have gained the ability to act, that was learning and then performing, and little bit about decision making also. In 2010 around, again the advancements that lead towards the deep learning. A deep learning that have like human-like intelligence. The concept where that was trying to mimic the neurons, neural networks. Or more precisely, if I will say that deep learnings, they are the synonym of neural networks, and something on the machines, they have gained the ability to make the decisions. Currently, addition of emotional intelligence and data science is surely going to revolutionize the medical history in the world. We can have the picture that despite of history of 3 or 4 decades, artificial intelligence have gained the momentum and made its strong presence. It had started with some simple equipment, some hardwares and consumers, moved on to the wearable big data and health analyticals, and currently the robots are there. I've given on examples that robot Pepper, or there is one more robot Paro. They have revolutionized and made the human community to think of that everything is possible. Human attributes, if they are compared with artificial intelligence, we can have a comparative part that perceptions, analysis, interpretations, memory, response, predictions, and emotions. These are some common attributes of human system. Machines, they are trying to mimic. Most of them have achieved their objectives, even to the level of predictions also, and working on the emotions also. I will cite some examples in my next slides, that how emotions based robots, they are doing miracles in Japan for the elderly patients also. How artificial intelligence is contributing in the healthcare. It's contributing on major 7 pillars, either transforming the future of healthcare, working on the data or the big data system, or communicating with the patients, Amazonifications of the health, participating or contributing in the clinical trials, maintaining the health records, or a close assistance to the doctors to perform the better diagnosis and the better surgeries. Artificial intelligence, machine learning, or deep learning, they're working with connections, and ultimately they're benefiting the medical history or the healthcare system like anything, and there is no parallel in the history of the medical science. That how they have contributed. Just have a glimpse of AI-based applications in healthcare, how they are contributing. They are playing the role in surgery, assisting like nurses, able to check out the analysis reports in drug discovery, fraud detections, or medical risk predictions, predictive care in clinical trials, and some medical data security also. So let's have a brief idea about what exactly artificial intelligence, machine learning, or deep learning means. In nutshell, if I will say, artificial intelligence they deal with the computers, to how to solve the complex problems. They are more goal-oriented type of machine systems. Commonly, some chatbots, online games, chess players. These are some of the examples of artificial intelligence. The subset of artificial intelligence that is the machine learning, as the name suggests, that they learn with each experience. There's a use of algorithms. After learning, they will have the capabilities to act differently, to take decisions also. For example, whenever you have used the Facebook, it will give you the suggestions that you may know. You can tag these friends. That depends upon the learning from the past experience. So machines, when they start learning, they can, or they will be able to provide some decisions also. Moving ahead to the deep learning, they can analyze big, large data set. Deep learning is like a hierarchical learning system. With each layer of architectures, whenever data is given for the successive layer, with each layer, the informations or the input is analyzed. Experience is shared with the next part. Some decisions are being taken. And with each progressing cascade of these layers, ultimately, or the end of the part, you will get a very refined data with better connections and correlations. Examples like virtual assistants, a vision of driverless cars, they are the best examples of deep learning concepts. Slide will represent the number of companies with logos and the areas where AI is playing or contributing in the healthcare system. You can have the glimpse that almost all the segments of healthcare, they are impacted by artificial intelligence directly or indirectly. So the first segment, that is 5G, AI and IoT enabled intelligent connectivity. How artificial intelligence is contributing to the healthcare. In Barcelona, the first 5G assisted surgeries has been done last year in 2019. Dreams has been made to the reality. Surgeons at remote areas, by using the 5G or the artificial intelligence, they can perform the complex surgeries also. Some days back, it was just dreams which has been made reality using the 5G, AI and IoT, the concepts. Even the wearable technologies, if clubbed with 5G technique or the 5G systems, they may send the informations, they may send the reports to the common data servers, and these 5G enabled techniques or the technologies, they may be helpful for the medical science. Even 5G enabled drones has been tested for the delivery of the life-saving drugs. In Sweden, the person suffering from, say, heart problems or the critical heart patients or some heart attacks, they were recognized well in advance by the wearable technologies. Information was shared with the common data server, and using 5G drone technologies, these life-saving drugs can be delivered to the patients, and that can save the life. That's how the AI, 5G, and the connectivity is changing the world. Some top pharmaceutical companies like Google Health with DeepMind, you might have heard. Alphabet, one more product of Google that is gathering the genetic informations, and ultimately that will be helpful for the healthcare science. Watson Health, that is working in the Mayo Clinic or the understanding the breast cancers. Babylon, an app that is popularly used in UK and 24/7 that provides the informations or the facilities to the healthcare workers. Ancora, that is a Philadelphia-based startup that is based upon for the treatment of cancer and the radiation therapies. Inletic company is dedicatedly working for the cancer treatment using AI-based techniques. Deep genomics, we are entering into the era of genetic therapies or the gene therapies and the big database of genome on the genetics that is coordinated using artificial intelligence, medical machine learning, and the deep learning. Wonderful resolutions like resolutions for the Wilson disease, the credit that goes to the artificial intelligence. Telemedicines, telehealth, or mHealth. In 1960, NASA have thought of to provide the telemedicines or telecare to the astronauts in the space. In 1960, he has funded the projects for the telemedicines. You can think of that some 100 years back, some 50, 60 years back, NASA was thinking of providing the telehealthcare or telecare to the astronauts in space. During this COVID outbreak, everything was digital. Even the digital system or the digital infrastructure of our country as well as the globe, that was helpful, or we can say they have made a paradigm shift towards the telehealthcare or the telemedicines. Our country that suffers from the lack of availability of the doctors and the nurses or the medical staff, strengthening our digital systems and investing more on the telemedicine or the telehealth, that may revolutionize our healthcare system. Virtual appointments, there has been a wonderful part in that particular COVID era, and number of people or the patients, they were given the treatment, the informations using this telecare system. mHealth app, some apps, they collect your informations depending upon some medical history, your lifestyle, symptoms from the chatbot. They try to analyze the data. They try to analyze the prescriptions or the treatments that was given by the doctors, and they try to provide the informations and the treatment to the patients. So emergence of this telemedicine or telecare using this digital network, using the application of AI, using the application of these medical learnings, they will revolutionize the medical care, and it will be very much helpful in our country where the qualified doctors and the facilities are not available to that extent. Next, we have that how the delivery care or health science that is transformed using the predictive care, the concept of social determinants of health. It means that some apps, they will gather your information about your age, about your lifestyle, about your family incomes, about your job profile, about environmental conditions, and after analyzing all the data, they may predict the healthcare problems in futures you may suffer. See how the artificial intelligence, they are changing the world. By analyzing your all social determinants, they may provide you the alerts, they may provide you the informations that what precautions you should take in future. Predictive analysis, they are playing a critical role to determine some ICU conditions, that how the people should be shifted to the general ward or hospital readmissions, or even that equipment maintenance needs may be solved using the predictive care. Using artificial intelligence, the predictive care that may save the lives of peoples, or by having an applications that they may check out the equipment's status also, and they may provide the informations or the necessary solutions so that there should not be any problems or the health issues due to the maintenance of these particular equipments. Artificial intelligence, Internet of Things, and data science, when they will work in coordinations, believe me, they will change the entire healthcare system. With this diagrammatic representations, we can understand that there is one pool of data that is gathered from the patients. That pool of data is stored on some network. Some another time, a person or the particular person is suffering from some disease, they will have the data of that particular person's in terms of his lifestyle, in terms of his history of disease, each and everything. Now, the patient data of individual person is matched with the already available pool of data using machine learning models, and they may provide some predictions or the potential diagnosis or the probability of this particular disease. This predictive model, how it works, these predictive models may gather the informations that these are the symptoms, or that kind of symptoms were already reported in database, how a specialist doctor have given the prescriptions, and how the treatment was done. By understanding the information of individual patients, matching it with the data available at the pool, using machine learning models or the deep learning concepts, they may predict the upcoming health issues, as well as they may suggest the exact line of actions or the treatment approaches. So that's how the artificial intelligence is changing the not only the diagnosis, but they are making or they are understanding the doctors and trying to give the solutions also. Means they are progressing towards the decision making, they are progressing toward the solution makings. Next is emotional intelligence. Already we have discussed that they have started understanding the concepts. Machines have started to make the decisions also. Now, by incorporating the emotional intelligence, by working on the neural networks like brain, it will do the miracles. Some examples I would like to cite. We have Robert Dinshaw, Robert Parrow. In Japan, for the elderly care peoples, they are forced to leave the jobs and take care of nobody is there to take care of them. What they have thought of, they have developed some robots. Robots have been made with artificial intelligence, and some concept or some emotional intelligence has been incorporated. These robots, they will be engage these old peoples in some simple conversations, or they will try to respond them. Believe me, one person has quoted that Japan, in upcoming time, they will not be the dogs. These small pets like robots, they are the friends of these particular old peoples. It means that these robots, they are replacing or some emotional intelligence, they are being incorporated, they are helping these old age peoples also. These concepts, when they will be introduced for some medical challenges, for the medical neurological disorders, or some psychological treatments, they may create a new avenue of the in medical history. Ultimately, the product, they need some FDA approvals. From the slides, we can have an idea that how they have penetrated and how they have established themselves for the FDA approval also. 64 AI or ML based FDA medical products or algorithms has been identified till date. Majorly on three fields: one radiology, second cardiology, and ophthalmological segments based products. They're capturing the 90% of the market. Way back, when Alan Turing have said that can machine think? Now it's the reality. That AI-based FDA products, they are in the market, they are getting approvals, and they are doing the miracle in the world. So we can expect the way artificial intelligence is progressing, next upcoming time, that will be the era of artificial intelligence, and it will be like a new normals that it will be with us. Let's have some glimpse of the realities. AI-based products which are in market and FDA approved. Quantex X was the first FDA approved in 2019 to check out the breast abnormalities. It was claimed that this particular AI-based product was 5 to 10 folds higher accuracy than doctors to predict the breast abnormalities. From diagnosis point of view, it was doing better than the doctors. ECG technology on Apple Watch Series 4 that can capture the heart rhythm irregularities. Heart rhythm irregularities, a severe kind of arrhythmia, if not treated, that may lead to the stroke also. So using this wearable technology, one can understand if there is some cardiovascular problems well in advance. AI Doc product that allows the radiologists to check out the intracranial hemorrhage in head CT scans. One more thing, these products, they are not going to replace the doctors, but they are going to facilitate, they are going to assist the doctors. Zebra Medical Vision, using ECG gated CT scans, Zebra Medical Vision, that is a product that can identify the calcification in the coronary arteries. People have been heard about, say, there is a blockage of arteries, a different percentage of blocking we have always heard, but there is one more problem, that calcium may get deposited in the coronary arteries. And to check it out that whether calcium is there, the Zebra Medical Vision platform have revolutionized the world. They have different techniques to clear that particular blockage. It was possible only because of that nobody had thought of that calcium can deposit in coronary arteries, and these are the cases of blockage 1 in 1 lakh. It was all possible because of Zebra Medical Vision or AI-based intelligence product. EcoMD, that software is helpful for analyzing the ventricular ejection fractions, and it can do better than the cardiologists. Again, I would like to emphasize that they are not going to replace, but they are going to assist the cardiologists. IDXDR, that is AI-based tool used to check out the ocular problems. Once problem is checked out, it can be addressed easily. So from these products, one can make the peoples to think of that.
Hello.
It's a reality. Let's have a glimpse of some FDA approved products. You can see these products from store detections, from managing the diabetics, checking the cancer problems, or analyzing the ECG reports. All those contributions are being done by these particular AI-based FDA-approved products. Day by day, they're growing like anything. Till date, 29 products I have encountered, which are FDA-approved and contributing in the healthcare system. And many more are expected in upcoming future. The way or the pace with which artificial intelligence is progressing and contributing in the healthcare system. Next, how it's contributing in clinical trials. Apart from managing the data, apart from having the informations, interpretations, analysis, predictions, there are some more contribution of this AI-based clinical trials also. Some days back, it was that we have to conduct some clinical trials, the data will be collected, then it will process to our interpretations, and then ultimately we will get some results. It was some time-consuming process. With use of artificial intelligence, machine learning, and deep learning, these data interpretations and decision makings, they are done very small span of time, and it will short down or cut down the time periods of analysis. Some examples that we were conducting some clinical trials and for one purpose, and we have got their approval from some other purpose. We have this particular one example of sildenafil citrate that was tried for some purpose, but ultimately it have come up with some other pleasant side effect. 1991, the first claim, but some other side effects, they were reported after 1 year. It have taken next couple of more years to understand or to analyze this particular side effect data. If artificial in current era, if that would have happened, then it might have done in a month or two. So what I want to convey that using AI, machine learning, and deep learning concepts, data interpretations, decision makings, coordinations, and all this connectivity, they may reduce down the time and may contribute positively. Some startups can have the idea that how different companies, AI-based companies or the startups, they are mushrooming like anything, and they're coming or they're contributing to the healthcare system. Some more examples of startups. Just have a glimpse of some health chatbots. If anybody have tried, then you can have an example like Babylon Health, that is on top. I already have discussed 24/7. It provides assistance to all the patients by understanding their family histories and their normal lifestyle. Yes, this is wearable technology. One survey and report by Accenture, they have claimed that the wearable technologies market have grown, say, 5 to 6 fold within a couple of years. It's attributed to the fact that sophisticated gadgets, they have the features and functionalities like patient monitoring, tracking the healthcare, and understanding all informations. They may give alerts to the pupils, and ultimately that may be helpful to the pupils. Some examples in our normal lifestyle like Fitbit, glucose meter, Apple Watch, Google Glass, they have revolutionized the industry. People are calling them wearable technologies as some family doctors, but they are replacing like family doctors. Some common information what they are gathering, they can check it out. Some heart rate monitoring, dehydration monitoring, tissue oxygen level, electrocardiography, electromyography, electroencephalography. Apart from that, some Google Glass or wearable technologies, they may gather the information about the humidity, air pollutions, dust, and some temperature, radiation monitoring, etc. It means that these technologies, they will gather each and every informations. They may share the information with the pool data, and accordingly we may get the alerts, and timely we can take some healthcare precautions. Some examples, again, like Apple Watch Series 4, that can check it out, the irregular heart rhythms or the arterial fibrillations. If they are not detected earlier, they may lead to the stroke. It means earlier detections using wearable technologies that can be life-saving. Fitbit, that is like a wristwatch, and it may check it out the sleep apnea, the problems during sleep. So some more examples like AI-driven breakthrough in healthcare. AI-based products, they can detect the skin cancer with a rate of 95%. And by doctor, it was reported at 87%. What I want to convey is that AI-based techniques, they can play a critical role in the diagnosis with better accuracy and better precision. AI-assisted gene therapy, the products is in phase 3 clinical trials. It means they are becoming the reality. To understand, to analyze, to control the genetic genome data, it was very problematic part. Using AI-assisted techniques or deep learnings, the data can be analyzed, interpreted, and decisions can be made. So in upcoming features, we are expecting that gene therapy, AI-based gene therapy will be in the market soon. Internet of Medical Things, Always you heard about Internet of Things. Now, medical science and engineering science, they have clubbed together, and both the sciences, they're ready to do the miracles. Next, we have robot scientist Eve. It's worth mentioning that robot scientist Eve, or the robots, it has given the decision, or we can say it has given the suggestions about a component called the compound that is a triclosan present in toothpaste, that it can work against the plasmodium virus, or it can act as an anti-malarial compound. So this particular scientist Eve, or the robots who have suggested, and when experimentally analyzed or tested, it was found that this compound have the strong anti-malarial potentials. Even it can work against the drug resistance malarial drugs also. So it means artificial intelligence, they are working wonderfully well. Google, they have created AI to detect the lung cancer better than the doctors. Depending upon these algorithms and computer tomography scans, these AI are more helpful or more accurate to predict the lung cancers. Believe me that we are progressing towards the deep learning. We are progressing towards the neural networks. We want to try to mimic like the brains of humans. And the day by day, the products or the applications we are getting from these particular AI-based products, they are more helpful to the treatment of the health issues of brain, like autism, like schizophrenia. By recognizing the speech using functional magnetic resonance imaging, they can detect the conditions in advance. To check it out, the cardiovascular problems in advance, the wearable sensors, the wearable technologies, they are doing the wonders. Future of healthcare system, compared to the recent years, 2020 have seen the most promising developments. Already I mentioned that the world was moving towards the lockdown, but the digital and the AI world was getting unlocked. They have unlocked all the possibilities and abilities that can change the total scenario of healthcare treatment or the diagnosis. Pandemic has proven that data, analytics, AI, and connectivity will only become more central to delivery care. All these have made us to think of that in upcoming future that is going to change the face of medicines forever. With success stories, FDA approvals, new startups, and mushrooming growth of patents and research publications, they make us to think of that the next era is the era of artificial intelligence-based products in healthcare, and they are going to change the whole scenario. We can expect a better treatment, better diagnosis. We can expect the predictive care, and even the concept of emotional intelligence that may be helpful for the treatment of some neurological disorders also. Last, it's robots, they never sleep and keeps on learning and performing. So we expect that someone is there who's working 24/7, and ultimately it will be helpful for the human system. At last, I would like to close my presentations with the words of Dr. Kai. He said AI is going to change the world more than anything in the history of mankind, more than the electricity. So let's hope that these robots, they are not going to sleep, and the way they are progressing, they are not going to replace the peoples, but they are going to assist and make the healthcare systems more strong and have a very promising future. Thank you. Thank you very much.
Thank you so much, sir, for your valuable cognizance session. And if anybody is having any doubt, they can write in the chat box or they can ask freely. So, any query or any question, it's most welcome. So, I feel there is no question.
Okay, just a minute.
Okay. Okay.
Mute.
Please.
Yeah. Surya,
Ji,
Gautam,
sir. Ji.
yeah, I think you cover much of the portion of AI, and this thing will be helpful for all the participants who are participating here, and definitely they learn from this, and this learning might be helpful in future when they are going for development of some new pharmaceuticals or innovations of new pharmaceuticals, or might be helpful when of new drugs. And definitely the one question is come from the Kunjwari sir. So just that madam will ask to you and you just try to explain that. Yeah.
Sir, thank you, sir.
Sir, one question is from Kunj Behari, sir. Sir, could you please tell us about role of AI in prevention of suicide attempts?
In presence of suicide attempts.
Yeah.
Okay. So in my presentation, I have discussed that we have started with the era of artificial intelligence, moved toward the machine learning, and moved toward then deep learning. Now people are working upon the emotional intelligence. They are trying to put the emotions in the robots. I have discussed an example of robot Paro. These are the robots where emotional intelligence has been incorporated. They will understand the persons and they will try to behave like these persons. Elderly patients in Japan, they suffer from some loneliness and the psychological problems. Nobody is there to take care of them. People's, due to busy lifestyle, they cannot give time to these peoples. So putting these concepts, they have tried to develop some robots with emotional intelligence. They can respond them. So I believe that that will be helpful to provide a solution to the peoples with some psychological issues. Second point, we have discussed some wearable technologies also. Wearable technologies, they provide the information of peoples when they are in stress. By using the Google app, Google or some even Apple's, they have some small apps that will provide you the informations about your stress level also. If you are exceeding that stress level, there is some conductance problem, there is some psychological issues are coming up, then they will provide some alerts. Once you are getting alerts, you will talk to your doctors, you will consult your psychologists, and the problems can be solved well in advance. So I think emotional intelligence along with the wearable technologies, they will provide the resolutions for the psychological issues and they may solve the problems also.
Thank you, sir. If anybody is having any question, they can ask here. Any other, if want to having any query, then they can ask. I feel there is no question, sir. I feel you have very beautifully discussed the concepts of artificial intelligence. You fill the gap, what is there in the artificial intelligence in the healthcare sector, as well as AI-assisted gene therapy, Internet of medical things, and how to detect autism and schizophrenia. Well explained with your presentation, sir. Thank you so much for giving us your precious time. Thank you, sir.
Thank you. So at last, I would like to thank my respected guide, Dr. Arun Kumar Gupta, for their blessings, and may their blessings shower on us forever. Thank you, sir. Thank you very much.
Thank you, sir. Now it's time to start our next lecture. So now it's time to start our next lecture on drug discovery in the past, present, and future. The resource person for the session is Dr. E. Manivanan, Assistant Professor, School of Pharmacy, DAVV Indore. But before moving further, I just want to give a brief about our resource person. Dr. E. Manivanan graduated from Dr. MGR Medical University, Tamil Nadu, with a bachelor's degree in pharmacy in 2000. He completed master's in 2002 from the Department of Pharmacy, SGSITS Indore. He received his PhD in pharmaceutical chemistry from DAVV Indore in 2010, and he was a research fellow in bioorganic chemistry at National Institute of Immunology, New Delhi. He was a postdoctoral fellow come visiting scientist to the University of Jyväskylä, Finland during 2011 to 2012. Dr. Manivanan's research is focused on development of a small molecule drug discovery for the cancer and inflammatory diseases. Dr. Manivanan has published more than 35 papers in high reputed impact factor journals, and Dr. Manivanan bestowed with the Career Award for Young Teachers for the discovery of anti-cancer molecules from AICTE India. We are very proud to have such an eminent personality with us, and I just request here to kindly, sir, to kindly deliver the lecture. Over to you, sir. Manivanan, sir.
Yes, ma'am. Thank you for the nice introduction. Very good afternoon to all. I'm delighted to speak in this AICTE-RGPV Joint Teacher Training Program organized by the esteemed organization Chameli Devi Institute of Pharmacy Indore, for which I am grateful to the coordinator, Professor Arun Kumar Gupta, Principal CDIP, and the co-coordinator, Dr. Ashish Pareshar, Associate Professor, CDIP Indore. Yes, so let me share my screen.
Yes.
Is it visible, ma'am?
Sir, yes, it is visible now.
Yeah. So the talk in this theme, this AICTE-RGPV Joint Teacher Training Program on Artificial Intelligence in Pharmaceuticals, Contemporary Status and Impending Prospects. So the participants of this teacher training program is hearing from yesterday onwards different aspects of artificial intelligence and their use in pharmaceuticals. So today, my topic of speech is drug discovery, past, present, and future. In this talk, I would like to present how drugs were discovered in the past and how the drug discovery progressed to date, means the present status, and then what will be the drug discovery in future. Maybe I can talk better with the case studies or the things happen in drug discovery in the past and the present, what is happening with a case study, and may give some suggestions or other inputs for future drug discovery. This is my talk. I plan my talk in this way. Okay, so first I will start with drug discovery. What is mean by drug discovery? Everybody is aware about drug discovery. Drug discovery is the process through which potential new medicines are identified. So this drug discovery involves a wide range of scientific disciplines, majorly chemistry, biology, and pharmacology. So drug discovery in the past, there are different strategies followed for discovering new molecules. And the strategies followed in the past are like traditional practice, brute force technique, serendipity, rational design. So these are the main focus or strategies in the drug discovery, which was in the past. So this slide shows the historical information of drug discovery of atropine, quinine, and morphine, right? So drug discovery by traditional way, so that is the first drug we'll see, atropine. This atropine is a anticholinergic drug. Okay, it has a mydriatic effect. It widens the pupil of eye, everybody knows. Okay, so because of its anticholinergic effect, it shows or it prevents sweating and accumulation of heat, hallucination. These are the pharmacological properties. So the atropine's pharmacological properties were understood from European culture. So this atropine, the source of this alkaloid, atropine, is Atropa belladonna plant. So the Atropa belladonna plant extract that contain this alkaloid atropine. So this plant extract is used in European culture. So the Atropa belladonna, this suffix name belladonna, meaning is it is from Italian origin. The word from Italian origin meaning beautiful women. So what is the relation between this beautiful woman and this Atropa belladonna? There is nothing like the plant looks like a beautiful woman or something like that. There is nothing. But the European culture, those days, the women's apply this Atropa belladonna extract for cosmetic purposes, meaning they use this Atropa belladonna extract for beautification purpose. That means it widens the pupil of eye, that gives beauty to the woman. It augments the beauty of women. And the application of this Atropa belladonna extract that prevents sweating. That means they don't have to use any deodorant or perfume for this. So by applying this, they get the benefit of preventing sweating. And then because when the sweating is stopped, the heat accumulates in the body. So the accumulation of heat further makes the woman's face redness in the cheek, and it augments further beauty to the women. And the women also fell in love with men, that while party going women, they take this Atropa belladonna extract because of its hallucination property. So all these pharmacological properties were understood from this European culture, the use of Atropa belladonna plant extract. So that leads to the discovery of atropine or atropine's pharmacological activity in such a way that that natural product drug alkaloid atropine is discovered. And the next drug what we are going to see is quinine alkaloid, which is an anti-malarial drug. This quinine alkaloid, it is isolated from cinchona bark. Cinchona bark, that cinchona tree is Cinchona officinalis. Cinchona officinalis. And this Cinchona officinalis bark extract contain numerous alkaloids. One of the major alkaloid, or one of the most active alkaloids among all other alkaloids, that is quinine. Quinine is less toxic and more active. otherwise cinchonine. Quinidine is more active and more toxic, and this drug quinine is more active and less toxic. And this remedy, antimalarial activity or its anti-fever property quinine, is learned by South American Indians in those days. In olden days, the South American Indians, Red Indians, lived in or lives in South America. They learned this remedy from their observation, day-to-day life observation, meaning is they learn this remedy from a mountain lion. Mountain lions, whenever they fell sick, they used to eat the bark of this tree and they recover from their sickness. Hence, the South American Indians, those who observed this incidents, and then they learned this remedy from this observation and they adopted in their lifestyle. Whenever they feel sick, they used to take the bark in the form of decoction or tea made by this cinchona bark. And this is the way that they learn this remedy. And this remedy was learned by when the Europeans, mainly Spaniards, captured South America. They learned this remedy and they brought to Europe. In Europe, Robert Tobler was very famous for this drug cinchona bark. And Joseph Cavendish and Joseph Pelletier, two pharmacists, they isolated this drug quinine alkaloid from cinchona bark, for which they credited they were made as a professor of toxicology in the University of Paris School of Medicine as toxicology professor for their discovery of this quinine alkaloid, isolation of quinine alkaloid from cinchona bark. And even today, you can observe the statue erected for these two people, Joseph Cavendish and Joseph Pelletier, in the streets of Paris. So this is the drug discovered quinine. So the nature yielded several of the biologically active compounds and remedy for different illness. The next one, which we are going to see is morphine alkaloid, one of the familiar alkaloid. This plant is Papaver somniferum plant. Papaver somniferum is opium plant, poppy plant, otherwise named as poppy plant. And this poppy plant contains more than 25 alkaloids. The major alkaloid is 15 to 20%. The content of this opium is morphine alkaloid. And everybody knows that morphine is a potent analgesic substance and it produces euphoric effect. It gives addiction along with analgesic activity, and it produces tolerance and respiratory depressant. These are the toxicity of morphine alkaloid. And burned drugs like heroin is synthesized from this morphine, right? And this morphine is a potent analgesic agent. It was extensively used, and many poets and the historian, they praised this drug as it is a gift from God to man for all his illness, to treat all his illness. So this drug was praised like anything, morphine. And morphine, its pharmacological and toxicological properties understand from Greek culture. So in India, we know that we offer herbs to our gods. Whenever we go to temple in Hindu tradition, whenever we go to Shiv temple, we offer bel patra, right? And then Vishnu temple, we offer tulsi. And then when people go to Lord Brahma temple there, they offer lotus to God. So similarly, in Greek culture, Greek people those days, they offer opium poppy plant, Papaver somniferum plant to their god, God Morpheus, God Hypnos, and God Thanatos. God Morpheus is god of dream, god Hypnos is god of sleep, and the god Thanatos is god of death. Okay, so you can understand now the pharmacological properties from this. The euphoria means a feeling, dream-like effect, feeling of wellness. That comes because from the name that morphine is also come from this plant which is offered to Morpheus god, god of dream, right? Euphoric effect. And then the sleep producing effect, hypnotic effect. So that is because of that the plant is offered to Hypnos, god of sleep, right? And respiratory depressant action that leads to death, this property is understood is the plant is offered to the god Thanatos. Thanatos means god of death. So the traditional practice gave so much information, wealthy information to identify the compounds of biological activity or pharmacological activity. So from European culture, Italian origin culture, the pharmacological properties of atropine is understood, and South American and Europe. So this gave information about the discovery of quinine, and then morphine, it understood from Greek culture. So this is where by exploiting the traditional practice or traditional knowledge, this is a treasure by exploiting or exploring this information, wealth of information, that we can identify several compounds, and these are bioactive compounds as drug molecules, and these are the examples. Just a few examples, that is atropine, quinine, and morphine. So in such a way that by exploring traditional practices, the drug molecules were discovered in the past. Next, further development in the drug discovery, that the scientists in those times, they started using brute force technique. That brute force technique, meaning is that random screening of large number of compounds. So that yielded a separate or a synthetic category of drugs that's called sulfur drugs. The first drug identified under this category, sulfur drug, is prontosyl rubrum. It is a red dye substance. This is otherwise named as sulfonamidochrysodine. And this is a prodrug. Everybody knows what is meant by prodrug. Prodrug is a pharmacologically inactive drug, and then after metabolism through biotransformation reaction, it becomes sulfonilamide drug, and this prontosyl rubrum, hence it is called prodrug. The sulfonilamide is the original drug which imparts its pharmacological activity. And then everybody knows this mechanism of action of sulfonilamide. Sulfonilamide is a inhibitor compound of this enzyme, dihydroteroate synthetase enzyme. By inhibiting this dihydroteroate synthetase enzyme, it inhibits the formation of folate coenzymes, which are important for the survival of the bacteria and parasites. So para-aminobenzoic acid is a substrate compound for this dihydroteroate synthetase enzyme, and sulfonilamide is a competitive antagonist compound for this enzyme, dihydroteroate synthase enzyme, and by inhibition of this enzyme, that leads to inhibition of folate coenzymes, which are vital for the survival of microorganisms like bacteria and especially parasites. So this drug was discovered through brute force technique. This drug discovery happened in German IG Farben Pharmaceuticals, and today it's Bayer Pharmaceutical. This IG Farben is incorporated into Bayer Pharmaceutical. The discoverer, the credit goes to the sulfonilamide category or sulfur drug category. Drug discovery credit goes to Dr. Gerard Domek. he awarded Nobel Prize in the year 1939 in physiology or medicine for this discovery. Sir Domak found this Brontosil. First, it is effective against Streptococcus species, and then he treated his own daughter with this medicine because the discovery of this synthetic drug dye substance was initially not accepted in German IG Farben pharmaceutical company. They were not willing to conduct clinical trial for this new drug, synthetic drug, Brontosil rubrum. Hence, Sir Domak treated his own daughter with her infection, and then he saved her from the amputation of an arm that because of the infection. So this incident is explained in the board of German IG Farben Pharmaceuticals, and then the company agreed to conduct clinical trial for this Brontosil rubrum. So that leads to the birth of new synthetic antibacterial agent, sulfanilamide drug. And this sulfanilamide is a starting point for thousands of new antibacterial agents, and nearly more than 20 antibacterial compounds belongs to sulfanilamide category, right? And this is brute force technique. And the next is drug discovery by serendipity. Serendipity is luck of research. Okay, everybody knows, but every time we cannot depend on luck, right? But Alexander Fleming is one exceptional fellow. He accidentally met with the drug, this penicillin, penicillin. Alexander Fleming has no intention of discovering new drug molecule, but he was working routinely, and he was growing bacterial culture for his routine work, and he observed that a petri dish containing a staphylococcus culture which is contaminated with the mold penicillin notatum, and this penicillin some green color material extracted from the penicillin notatum or exudate comes out of this penicillin notatum mold that kill the bacteria of this belongs to staphylococcus culture. Okay, and this observation made to the discovery of new drug, that penicillin antibacterial agent or antibiotic at those time. In 1928, Sir Alexander Fleming discovered penicillin, and he also received Nobel Prize for this extraordinary drug, life-saving drug, penicillin, in the category of physiology or medicine in 1945. So he served his Nobel Prize along with Flory and Chain, two other scientists who have large produced this penicillin with penicillin chrysogenum, other species. So this is a luck of research. So this drug discovery, this we cannot consider as a strategy, that serendipity, it comes like accidentally. Okay. The next example we see for this serendipity example is sildenafil citrate. And this is something like the scientist in the UK, that is UK Pfizer Kent Sandwich site. They were looking for the discovery of antihypertensive drug, new antihypertensive drug, and for which they took the target PDE3, that is phosphodiesterase 3 enzyme, as a drug target, and they carried out this drug discovery process. So initially they identified a lead compound for this phosphodiesterase 3, and then they modified the lead compound, and that leads to finally a compound called as sildenafil citrate, and it was named later a brand name, that Viagra, sildenafil citrate, and they aimed for the discovery of PDE3 selective inhibitor for the purpose of developing antihypertensive drug. But this turned out to be something different. So instead of inhibiting phosphodiesterase 3 enzyme, the drug is selectively inhibiting phosphodiesterase 5 enzyme. Instead of inhibiting PDE3 enzyme, it is inhibiting phosphodiesterase 5 enzyme selectively. So that is why it is not effective as antihypertensive drug, or it was not effective in lowering the blood pressure. Instead, it is causing something different effect. So the scientists were hoping for discovering an antihypertensive drug, but the drug failed as antihypertensive drug, but it is showing something different biological action, that is male erection, the different biological action, and that is something intriguing, that is male erection, induction of male erection. Hence, at the time, there were no drug for the treatment of male erectile dysfunction, MED, male erectile dysfunction, but the scientists, hence they tried to develop this molecule. So the failed molecule as a BP lowering drug become a successful molecule for the treatment of male erectile dysfunction, because this inhibits phosphodiesterase E5 enzyme, phosphodiesterase enzyme 5 instead of phosphodiesterase 3 enzyme. So this because it the action of this phosphodiesterase enzyme 5 is to degrade the cyclic AMP to GMP, hydrolysis of cyclic GMP to GMP molecule. And this drug, sildenafil citrate, it selectively inhibits this enzyme, phosphodiesterase PDE5, and hence the cyclic GMP concentration, it's not degraded. This leads to reduced concentration of calcium in the muscles, that specifically this leads to smooth muscle relaxation and then increased blood flow in the penis, that leads to erection. So the meaning is the luck of research serendipity. So the scientists were looking for the successful development of anti-BP drug. So they failed in developing antihypertensive drug, but they are successful in developing a male erectile dysfunction. So that is something new at the time, because there were no new drug, or there were no drug for the male erectile dysfunction drug, and this is the first drug for treating male erectile dysfunction. Hence, the clinical trial was conducted in 1991, and the approval from FDA received in 1998 for this male erectile dysfunction, and the sildenafil citrate or Viagra become the blockbuster drug. And this is an example, another example for this serendipity. Now we will look for this drug discovery by rational drug design. Rational drug design example that we can cite, the anti-ulcer drug cimetidine, H2 receptor antagonist, and in this case, the cimetidine were here. So for the first time, some important principles, chemical principles applied in discovery of new molecules. That is physicochemical properties with lead optimization. So this drug H2 receptor antagonist was developed by a group of scientists, Robin Ganelin, Graham Durant, James W. Block. They were working in SmithKline French, and these days it is SmithKline, GlaxoSmithKline. And this James W. Block is credited for the discovery of propranolol drug. And in the discovery of propranolol drug, he used the concept that, so using agonist molecule as a starting point for the development of antagonist molecule. So the same principle applied here. So this anti-ulcer target was selected is H2 receptor, histamine receptor 2, and agonist for this H2 receptor is the natural ligand, that is histamine. So the histamine agonist is structurally modified to obtain the cimetidine drug. This is the same principle followed in the case of propranolol. The agonist is structurally modified to become an antagonist molecule. And Sir James W. Block received Nobel Prize in 1988 for this discovery of propranolol, and also is credited for the discovery of cimetidine. So this is an important thing in rational drug design, that is application of physicochemical properties with the lead optimization. So the tautomeric form of histamine is utilized in developing the molecule cimetidine. So they found out the requirement for blocking the H1 receptor and H2 receptor, selective blocking of H2 receptor. So the conformer tautomeric structure which is needed to develop the antagonist molecule. This is an example for this rational drug design, cimetidine. Next rational drug discovery example is omeprazole drug. Omeprazole is a proton pump drug, and this proton pump inhibitor, you can call it as proton pump inhibitor. And proton pump inhibitor drug, this is the drug developed is omeprazole. Omeprazole is a benzimidazole based molecule, and it is a bioprecursor prodrug, omeprazole. So at acidic medium, the molecule undergoes rearrangement. That rearrangement is called chemically, it is Smiles rearrangement. So that makes or enables the sulfur bond. So the sulfur atom of the omeprazole molecule that bonds to proton pump enzyme. The proton pump enzyme is H plus K plus ATPase enzyme, and its important role is controlling the acid production. So the proton pump exchange the proton with the potassium by taking a potassium ion inside the cell. It expels the H plus ion that makes that combines with the chlorine atom, and it produces gastric juice, hydrochloric acid. So this is inhibited especially by this proton pump inhibitor. Proton pump is controlled by several superficial receptors. Those membrane receptors, they are like H2 receptor, muscarinic receptor, acetylcholine receptor, gastrin receptor, and prostaglandin receptor. And they have different positive controls and negative controls. Histamine receptor works or controls the proton pump through cyclic AMP pathway, and this acetylcholine or muscarinic receptor and gastric receptor, they control the proton pump through calcium dependent pathway. Okay, and prostaglandin receptor, this has a negative control over the proton pump, and this drug omeprazole, it directly inhibit the H plus KTPase K plus ATPase enzyme, bonding to it with the sulfur-sulfur bridge, and because of this covalent bond, strong bond formation between the drug and the enzyme, that leads to irreversible formation of the acid production. Okay, so this is all the rational drug. So the drug discovery progress from the natural product based drug discovery to slowly the brute force technique, random screening of large number of either natural compounds or the synthetic compounds, and then rational drug discovery by utilizing certain principles in the chemistry and physics is used in the discovery of new molecules in such a way that drug discovery progressed. Now we will talk about the drug discovery process in the present status process. Okay, so identification of a drug target, protein target, which is involved or modulating the disease, that is the prime step in drug discovery, target drug discovery. And this takes approximately 2 to 3 years of time, expression studies, and then in vitro function, in vivo validation, knockout assays, and then bioinformatics. This is all involved in target discovery. And next to the target discovery, drug discovery and screening. This discovery involves the traditional approaches, combinatorial chemistry, then utilization of structure-based drug design, screening, in vitro methods, ex vivo methods, high throughput screening. So this is all for the purpose of identification of hit molecule. So this takes approximately 6 months to 1 year. And the third stage is hit to lead. From hit to lead, and then lead optimization stage, where application of traditional techniques, traditional medicinal chemistry approaches, and rational drug design, this takes 1 to 3 years of duration. And then next is evaluation of pharmacokinetic properties, absorption, distribution, metabolism, excretion, and toxicity studies. The bioavailability and the systemic exposure. So this all takes 1 to 2 years of time. And then next one is a developmental stage, where here the preclinical studies and the clinical trials are carried out. So this is a phase 1, phase 2 clinical trial, and then going for registration, that and after registration, and then this drug molecule reaches the market. Okay, so this is the drug discovery process in today's scenario, and this takes a lot of time when you apply conventional methods. When you apply computer-based models, you can reduce the time duration, and you can also reduce the cost factor. So now chemical space, we will talk about chemical space. What is meant by chemical space? Chemical space, that chemical can be generally defined as the universe of synthetically feasible small molecules less than 500 Dalton, that is estimated to be in the order of approximately 10 to the power 60 molecules. So the visualization of this plot, that is a chemical diversity plot, diversity chemical library. This shows the different compounds like oligosaccharide molecules, DNA, diamonoids, graphenes, and NCHR ligands, alkenes, some peptide molecules, and then RO5, that means RO3, the rule of 5 thumb rule, and rule of 3 rules, and then druggable molecules. So this was classified, and then Raymond Group at the University of Bern in Switzerland, they developed a computational algorithm that enumerates all possible chemical structures that can build from 17 heavy atoms in their GDP17 database, which amounts 166.4 billion molecules. So we have large number of molecules, and we don't require to synthesize new molecules. We can even look for the new drug molecules within the available chemical space. And it is not necessary to generate new chemical moieties in most of the cases. In most of the cases, you can look for new drug molecules within the available number of chemicals. Overview of computational drug discovery, that already we talk about the steps or the process of drug discovery, where here medicinal chemistry, what we can do with the medicinal chemistry, high throughput synthesis, high throughput screening, then privileged structures, bioisosterism approach, application of chemoisosteres, and scaffold hopping, like medicinal chemistry approaches can be used in drug discovery. So the fragment-based drug discovery is docking, fragment-based QSAR, ligand growing, and then ligand-based approaches like ADMET analysis, QSAR, pharmacophore, statistical, molecular design. So this all the cheminformatics approaches, computational chemistry, calculation of molecular descriptors, chemical space, profiling, filtering, utilization of Lipinski rule of 5 and criteria, and then search like molecular similarity search, substructure similarity search, shape-based screening, molecular volume-based screening, charge-based similarity analysis. This is all the fragment-based drug design approaches, ligand-based drug design approaches that can be blended with the medicinal chemistry approaches to develop new drug molecules. And next, structure-based modeling. Structure-based modeling that involves molecular modeling, protein structure prediction, homology modeling, comparative ab initio molecular dynamics, mode analysis, binding mode analysis, docking or reverse docking, binding cavity analysis, pharmacophore. So for which you need databases, small molecules for docking that can be obtained from drug bank that contains a large number of drug molecules, Kimball database, PubChem database, binding drug bank database, and then zinc database. Protein structures that you can get it from others, be protein data bank, UniProt, Scope, and then protein-protein interaction studies like protein-protein interaction, MINT, stitch, string, and then pathways like KEGG and reactome, and system-based approaches like protein-ligand interaction, protein-protein interaction studies, drug target gene expression, intrinsically disordered proteins, and allo network drugs. So application of bioinformatics, chemogenomics approaches, and blend with the medicinal chemistry that we can obtain large number of successful drug molecules. These are different possibilities of bringing successful drug molecule from bench to bedside. Now, the drug discovery process challenges. What is the challenge in drug discovery process? The one challenge is the cost factor. High investment is needed in drug discovery. And the other one is it is a lengthy process. It is a time-consuming process. So, and here in drug discovery, what we face is high attrition rate with a high profile failure. High profile failure and high attrition rate, failure rate. This is the major problem in drug discovery. We, as a drug discovery scientist, they face. So the solution for this in today, they apply artificial intelligence, machine learning, and deep learning techniques to achieve the drug molecule in a quicker way with less investment. So what is mean by artificial intelligence? This you have been hearing since yesterday. Okay, now simply I say that allowing the machines or computers to think like human, this is what artificial intelligence. Human intelligence, that what we have, that human intelligence. Artificial intelligence, the meaning is allowing the machines to think like human, or allowing the computers to think like human. This is what simply artificial intelligence. What is mean by machine learning? There are, before that we will talk about this artificial intelligence. What is the subtypes in this? That is a narrow artificial intelligence or weak artificial intelligence. This is good at solving one specific problem. Narrow artificial intelligence, it is good at solving one specific problem. General artificial intelligence, meaning it's like a human-like intelligence and it does not exist in machines. And super artificial intelligence, superhuman intelligence. And these are the types of different types of artificial intelligence. Narrow or weak artificial intelligence, general or hard artificial intelligence, super artificial intelligence. What is mean by machine learning? Machine learning, a numerical method that given certain data tries to find a way to explain the data and predict future data. That means you are allowing the machine to learn your input data and then train the algorithm, and then based on that it predicts the future data. The data can be predicted. This is what machine learning. And what is mean by shallow or deep neural network? Neural network, this is mean machine learning architecture. This is loosely inspired by the human brain, and it is made of a set of units, that is neuron. This is what deep learning. How this machine learning works. Okay, so for example, cat and dog, you label them as cat and dog, and you train the machine or learning algorithm, train the machine, train the computer to know this is cat and this is dog, and based on that, the learned algorithm, that classification model is developed. So this developed classified model is used for the prediction of your new data. So that is when you apply this new data to the classifier model which you already developed, that will generate the hypothesis. So this is a dog and this is a cat. Even if it structurally in the figure you can see it varies, cat and dog picture, it is not the same picture, but still your classifier model, this machine learning algorithm identifies, or the classifier model you developed using this machine learning method classifies exactly dog and cat. So this is how the machine learning works. So your input data is good, then your model is good. And you can also get a high rate of prediction. Why deep learning and why now it is required? Deep learning neural nets with a large number of parameters are very powerful machine learning tools. So this deep learning is available since 1940 in the name of neural nets in 1940, and 1970s they were developed as a deep neural nets, and in 1980 onwards they are named as deep nets for computer vision. But these methods, they have problem. These old methods, they have problem, that is overfitting and slow for the data, underfitting, desired fitting, and then overfitting. You can understand from this picture. So the desired fitting is required. So in the old case, we get overfitting. So the new solutions developed over the past decade, that is dropout procedure to drastically reduce overfitting, increased hardware performance. Overfitting, that is by using dropout method, and the process was slow in the old method, and in this new method, by increasing the hardware supercomputers, like instead of using CPUs, using GPUs, accelerated GPUs, though this slowness can be reduced, means we can fast the approach. Big data, very large data sets, they can be analyzed computationally by applying this deep neural network, and then cloud computing is helping in storaging, and also it helps in performance. So when you use machine learning techniques, so when you raise the amount of data, if the data is large, then the machine learning performance is low. And in this same case, when for large amount of data, you can apply deep learning, it gives very good results. And then AI, ML, how to the general considerations. General consideration, domain understanding of the problem is to solve is key. Domain understanding of the problem to solve is key. So machine learning in drug design, you should know drug design. So for application of machine learning in drug design, first you should know drug design. The problem to address the needs to be machine learnable. So the problem is well formed, then you can maximize the number of compounds. So you can use a narrow AI in this case. If the problem is not well formed, so what exactly is the goal of a chemist for this is you can apply general AI. That means human intelligence is required in this case. The problem is not well formed. Any learning system is only good as the data provided. If the data provided by the scientist is good, then your learning system, machine learning output is good. So you require a clean, homogeneous, and compatible in-house data. For example, water solubility data collected all in the same way. So, and this is again an issue in the academic institution or small pharmaceutical companies, and it is better for big pharma because the in-house data generation for academic institution, small academic institution, it's not possible. And getting the water solubility of all drugs in the same way in academic institution, it's not possible. For it's not in the small pharmaceutical company. For big pharma company, they can have the in-house data for water solubility of different drugs. So this is possible. Clean, homogeneous, and compatible in-house data is required to get the good prediction machine learning, and this is possible with the big pharma companies. Choosing the right algorithm is considering the problem. So either which algorithm you require, okay, the classification versus regression model. Just because you can use deep learning all the time, it doesn't mean that you should do this deep learning. Deep learning challenge to use if you work for a small company or academic group. It is challenging. So because the lack of expertise and cost to bring the right people inside, and then it's a defendable large data set with a sufficient number of examples for deep learning to work are expensive. And now AI machine learning, how to common practice, that is data preparation, determining the answers we want from the model. So this is the first prime need in data preparation, determining the answers we want from the model. So for example, in drug discovery case, what we do is we predict an activity of class of for new compounds. And the second one is collecting and cleaning the data, collect existing compounds with activity in enzyme inhibitory concentration. The next step is similar like QSF, futurization, creating the input model for the data. That means by calculating different molecular properties, example like molecular weight, polar surface area, and many other properties. So that this can be used as structural or property futures. And the next step is future selection or extraction. So some of the descriptors may not be needed and they are extracted out of this data. And using this input data in as the IC50 values and all the molecular properties, structural features, we train the data set to this particular algorithm, and then by using testing this algorithm, and we develop a model, and then fine tuning of this model, finally we deploy this in prediction of new molecules. So this is what we can do machine learning for drug discovery, data preparation. And why and where artificial intelligence or machine learning in drug design? Declining R&D efficiency, cost per drug is exponentially, that is 2.6 billion is required, but sales are not, and this is the problem. Declining R&D efficiency, cost per drug is rising exponentially, that is like 2.6 billion per drug molecule, and in the same time the sales are not okay. So less than 1% of the drug discovery projects are successful. So hence this drug discovery is not a sustainable business model. So this is the problem. Okay, and by here we can apply artificial intelligence or machine learning in drug discovery. So there are a lot of rooms for innovation. The process, the drug discovery process need a reboot. Target validation, hit generation, lead identification, lead optimization, and preclinical drug development. In different places where we can apply machine learning method, and then we can increase the success rate, success of the drug discovery project. Better data mining of very large compound data sets. For example, data mining of large compound database. There is a Enomine real phase. It contains more than 5.1 billion molecules, and then you can generate innovative generative molecular design models, and this can we can create a novel IP generation, patent predictive models for ADME, tox, and physicochemical properties. So we often face the difficulty in modeling the endpoints such as time-dependent cytochrome P450 inhibition, where the 3D and structural fragments, they play a major role. So we face a difficulty here, and we often have problem in melting point data set with a large number of compounds, and then DMSO solubility with over 163,000 compounds. So the predictive models, by applying this we can applying machine learning methods, we can successfully predict, or we can successfully develop good predictive models. So we can apply Kimball and PubChem activity datasets, chemical synthesis planning, unprecedented efficiency via scientific literature, inferencing and reasoning, protein structure prediction. Even protein structure prediction, there's a target validation. This can be done with artificial intelligence and machine learning method. AlphaFold recently in December 18, he won this Cas13 protein folding competition. So that was successful application of machine learning in protein structure prediction. So now I have time for this case study. So the case study, neural network based identification of selective senescence agonist. Think so senescence and cancer, everybody knows this. Cancer is abnormal cells replicate in uncontrolled way. So this is what cancer metastasis, this is how cancer spreads. Cancer metastasis is responsible for over 90% of cancer related deaths. Cellular senescence, it is the phenomenon by which normal cells cease to divide or limiting their replicative capacity. So this induction of senescence can be exploited as a basis for anti-cancer therapy, means development of anti-cancer agents by applying this senescence agonist strategy. So the goal is using machine learning to identify potent small molecules which are capable of selectively inducing senescence, means ceasing the abnormal growth of cells agonist. This is without significant cell death. So this is a case study. I think I don't have much time to go for this. It's already 15:25. So what I do is I skip this case study. I will show some only the importance of this. So by application, this is the information I extracted from this Neoplasia journal. Identification of selective G1 phase benzimidazolone inhibitor by senescence targeted virtual screen using artificial neural networks. So in this case, what they did is by starting with a large number of compounds, means 2 million lead-like compounds, and slowly they reduce the hits by like 1700 hit molecules, means reduce the number of compounds, and identified 17,000 hit molecules. By application of different filters, they identified 4,929 possible senescence agonist hit molecules, and then finally using pharmacophoric clustering and knowledge-based selection, they identified 147 medcom friendly compounds for senescence activity. So in this, they finally identified 15 hit molecules, which are twofold FSA-B gal activation. That means it is a beta galactoside activity. So senescence associated beta galactosidase activation activity. In this assay, they identified 15 hit molecules which are having less sub-micromolar compounds, and this is the ligand molecule. They identified hit molecule, right? So this is one successful application of artificial neural network. So this is what people are doing right now. So in the present drug discovery scenario, they are applying artificial intelligence, machine learning methods, since we have a large number of databases of small molecules and biomolecular structures. So we can efficiently apply this machine learning methods to identify drug molecules. So what the future drug discovery? In short, big pharma companies currently, they are cutting their own R&D arms, and they are buying new biotech companies, big pharma companies. They are cutting their own R&D, research and development arm, and they are buying. They have started buying biotech companies. So recently in Eli Lilly, CEO, his John Leachleiter said, highlighted the problem in the R&D field, research and development field. That is, our industry is taking too long time. The pharma industry is taking too long time to bring new drug molecules, and we are spending too much of money, and we are producing far too little one. So most ironically, this crisis in our innovation model that comes at a time when we have vast more scientific knowledge and data than ever before. So now we have a large number of scientific knowledge that is available in the form of data, but our R&D funds are cut. Okay, so this is the problem we are facing, but unless we change the way we do research, we won't be able to translate all this knowledge into advanced stage. So this is what Eli Lilly CEO John Leachleiter said about the drug discovery in the present scenario. So we have very less amount of money for as an investment in R&D sector in pharmaceutical companies. With this low investment, we need to conduct the drug discovery process. That means this artificial intelligence or machine learning, these methods can help very much. So that leads to successful future drug discovery. That's all I want to conclude. Thank you so much. And I give credit for the excerpts which are taken from the presentation of Angelo Pugliese, PhD, and from UK. and Dr. Karthikeyan Chandrabose for providing some inputs. Thank you. Thank you so much for listening to my presentation.
Thank you so much, sir, for your value addition session. Definitely, the concept of drug discovery and artificial intelligence will, in the near future, will provide the more of the potential things in the market, potential drugs in the market, and definitely your lecture is providing all the information from the basics to the up to the artificial learning. Thank you so much, sir.
Thank
Here,
you.
I request all the participants, if you are having any query, then you can ask the question in the chat box. If anybody is having any query, can ask the question.
I think there is a question, ma'am, from Dr. Sanjay. What are the
Yes.
precise rules of machine learning in drug discovery, sir?
Precise rules of machine learning. Actually, machine learning method, we can use it in drug discovery in different stages. So for lead identification, what we can do is that's the major area where you can apply machine learning methods. So this is to predict the new drug molecules, whether the molecule will have the required activity or not. So this classification models, this will help us. So the existing information that can be given as a input data. So by using this, we can predict the new drugs or new molecules activity, bioactivity, whether this molecule will have activity or not, pharmacological activity or not. So this kind of a prediction can be made at initial state. So that will be much more useful. So the prediction of bioactivity, biological activity or pharmacological activity. So in this case, in lead identification case, we can apply machine learning method. So in a recent publication, one of our publication that we did toxicity prediction, that is a cardiotoxicity prediction. You can read that paper that is published in chemometrics and modeling. So that gives information about the prediction of cardiotoxicity of molecules.
Okay, thank you very much, sir. I would like to request you to please close your PowerPoint presentation so that our new speaker could join and share.
Okay. Thank you.
Okay, thank you very much, sir, for joining with us. Ma'am, please.
Now, it's time for the next session. The next session will be given by Dr. Vinay Singh, senior scientist, Bios Lab, Department of Biosciences and Bioengineering, IIT Mumbai, on the topic application of AI in screening of COVID-19 and TB. But before moving ahead, I would like to give a brief introduction about our speaker. His current research includes rapid COVID-19 diagnostics, CRISPR-based COVID-19, TB diagnostics and therapeutics, real-time data for child malnutrition, formulation for MRSA, and VRE infection. He is also involved in the projects like mosquito repellent formulations, vaccine research, and he has attended various national and international seminars and conferences in USA, Mexico, Singapore, Switzerland, Austria, and Netherlands. He was interacted with Honorable PM Sir Dr. Narendra Modi ji to showcase his research during technical exhibition IIT Bombay, where he demonstrated rapid TB test. He was also interacted with Honorable HR Delhi during technical exhibition, and he got Arohan Social
Thank you. I did my job. That's okay.
Foundation, Infosys Foundation in 2020. He is the lead PI and has received so many grants. He is the lead PI for the DST Seed Grant with 20 lakh rupees for IIT Bombay for developing rapid TB test, and received Arohan Innovation Award with the Infosys Foundation, which is a gold award with 20 lakhs for developing rapid TB test. He was also the project investigator for the grant under BRICS countries which is costing around 2.0 crores. DST Kavach grant, cum loan of 1.5 crores for the rapid COVID-19 diagnostic, and Indo-US grant, that is CRISPR based test for the COVID-19 with amount 50 lakhs. He is also the co-PI on TB therapeutics in India Health Fund with the 2.0 crore grant, and as a co-PI for the development of aerosol formulations for MDR-TB on TB diagnostic. So for the session for today, we have the very eminent personality, and I request Dr. Vinay Sani sir to please move ahead and go for your presentation, sir. Sir, I request you. Thank you.
Yeah, thank you, Priyanka, for nice introduction. And am I audible?
Yes, sir.
Yes, sir.
Yeah. Do I have to increase volume, or is it optimum?
No, it's okay, sir.
Okay.
Okay, good. So thank you, Principal Sir, and Ashish Para Sir, who is my junior from Sagar University, and I visited this your institute maybe in 2 years back in 2019 during a presentation with this nuclear medicines. So this is a nice institute, and I thought that this institute is very dynamic, and should start some incubation facility to translate the idea of B Pharma and M Pharma students, and also PhD students. So let's work together. Yeah, and let's start this. And before so good afternoon, everybody, and all participants. You are most welcome for the topic on medical imaging based on artificial intelligence, solutions for public health screening based on tuberculosis and COVID-19. So I am giving main emphasis on tuberculosis and COVID-19, as we have been working mainly for these two diseases, and they are having vast similarity in terms of radiological screening. So you know that artificial intelligence or machine learning is growing rapidly, and we are expecting that after 3 to 5 years, uh, uh, most of the diagnostics they will adopt or artificial intelligence would play important role for the application and diagnostics of different diseases. So now I am going to start from this first slide. And then team members, we have collaborated recently with Deep Tech Technology in Pune. So my apart from myself, Dr. Amit Kharat, who is leading this foundation institute in Pune, and Dr. Anuradha Pant and Ajit Patel. So they have been working on artificial intelligence, and till date they have diagnosed different diseases, mainly for tuberculosis and COVID-19 recently with few cases. And this tuberculosis is mainly based on this artificial intelligence and screening based on the screening based on the radiological imprint. So what they have do, we used to develop an algorithm in artificial intelligence based on the data which is provided by different medical colleges and hospitals, like chest x-ray and sonography for different types of the diseases. And on the basis of this algorithm and data, so we used to collect this data for finally for developing algorithm for artificial intelligence. So now come to the next slide. As you know, the TB is highly prevalent in our country, and around 11.1 million people they fall ill with tuberculosis. Among them, 26% people they have they are covered by India. So TB is basically the problem of high burden countries, like four high burden countries like say, India, Southeast Asia, South Africa, China, and Brazil. They are these four high burden countries, but it's slowly spreading, or it's also some few cases were also reported in US and European countries also. So now the diagnosis for and screening of the tuberculosis is based on the WHO approved compliant test like sputum microscopy. So its sensitivity is very less, around 60%, but it is first the screening technology for tuberculosis. After that, sputum culture is gold standard, and its sensitivity is very high, more than 90%. But it takes time, around 6 to 8 weeks, or sometimes maybe 10 to 12 weeks. Gene expert is it doesn't take time, but it is not highly standard than sputum culture, or and it's quite expensive, and its cost is around 1,200 to 2,000 rupees. Other screening tools like Montauk's test, is tuberculosis skin test, and IGRA test. So they are either insensitive or uh, time consuming. So for this, what we have to do, we have to do early diagnosis of the tuberculosis, and there is a vast opportunity for 60 to 90 million people. They get tested for active tuberculosis per year. Among them, 40 to 50% they are covered by 4 high burden countries like India, China, Brazil, and South Africa. So there is a potential market for TB test. But how we have to develop these different types of the test? So now come to the slide, another slide that you can see here that around 70 hospitals for artificial intelligence and medical imaging centers have been covered by our partner. And apart from tuberculosis, we worked on this COVID-19 also. So 10,000 scans earlier they covered for TB screening using artificial intelligence, and 40,000 scans were processed every month. So scaling stability, patenting papers, and among them the team member is about 25 technocrats and 25 radiologists, more than 20 radiologists. They worked on this project. So now come to the main part. What is GenKey? GenKey is a radiology artificial intelligence based solution for public health screening. It leverages cutting edge artificial intelligence solutions for analyzing chest x-rays and CT scans to automatically triage patients in a speedy and cost effective way. GenKey covers over 17 different chest pathologies and delivers comprehensive values in terms of public health monitoring and management. So it covers, you can see in this slide, it covers very high volume. Comprehensive pathology covers for pleural thickening, cardiomegaly, edema, effusion, COVID-19, pneumothorax, mass, tuberculosis, infiltration, granuloma, foreign objects, pneumonia, consolidation, fibrosis, and hernia, and also emphysema. So how these tools are compared with presently existing screening tools for tuberculosis as well as for COVID-19. So AI-based powered public health screening is based on chest X-rays and CT scans for particularly for these diseases. And you can see there is a difference between the chest X-ray of if a person is infected with chest tuberculosis or COVID-19. So there is a difference between the location of the infection, upper and lower lungs. They are so artificial. So deep tech technology is based on the inbuilt of the AI engine with expert in the loop. So these experts like clinicians or chest physicians, they work parallelly, and with the help of these clinicians, an accurate and cost-effective means affordable rapid screening can be done on the basis of chest X-ray and CT scans. Now come to the next slide. So uncompromised accuracies. It was observed expert in the loop modules ensures that AI models are turned into the local surface source of the data and local cohort conditions before being deployed into the fully automated mode. So before going into the fully automated mode, these things are done in a phase manner. 3 different phases have been shown in here. So in first phase, the radiologist work, and then till 5 to 10,000 positive cases are processed. All 100% of AI outputs is reviewed will be reviewed by radiologists and corrected by radiologists. In phase second, till 10,000 to 20,000 positive cases are processed, and about 20 to 30% scans will be reviewed by radiologists. 20 to 3%. In phase one, you can see compare the phase one and phase two. Then in phase one, 100% cases are reviewed by a radiologist, but in phase two, 20 to 30% cases are reviewed by radiologists. In phase third, this is more advanced phase, and about 5% scans are audited by radiologists to confirm AI accuracies. So accuracies for diagnosis, whether it is diagnosis, whether it is screening, accuracy is most important part. On the basis of that accuracy, we can predict or generate accurate report towards or for a particular disease, whether it is COVID-19, tuberculosis, or other disease. So what is AI model? Continuous. So it depends on the accuracy matrix of artificial intelligence. So based on the accuracies, the further we can increase or increase the sensitivity of the technology. So till date, Deep Tech has done TB-free Chennai initiatives with NIRT Chennai, this National TB Reference Laboratory. So you can see this mobile van where the AI models were deployed on the field to screen a larger population. So you can see this inside the infrastructure of this mobile van. There is a chest X-ray machine, and there is a large screen you can see here in left lower side. And then conventional way is depends on this. So conventional way before AI, artificial intelligence, symptomatic patient screening is done on the basis of the symptoms, whether is there any symptoms in chest, problems in breathing, or some congestion in chest, and also some other relevant features or symptoms based on relevant to tuberculosis and COVID-19. So here this AI powered community screening is done from earlier it was done for tuberculosis using the mobile when screening. So workflow depends on the screening and instant triaging as solution. So deep tech artificial intelligence work was done in step 1 using the radiographer, which takes chest x-rays. In step A1, which is platform suspects and normals are identified, and in step A2, sputum samples are collected for suspects and sent for further tests. So this was used for preliminary screening. Finally, the confirmation is done for the TB patients or for COVID patients by sputum samples, or for TB patients, which is done for sputum culture, which is gold standard, as I have told you in earlier slide. While for COVID-19, oropharyngeal or nasopharyngeal swab is collected. So based on these things, TB suspects, potential COVID-19 suspects like pneumonia, consolidated patients, and other pathologies. So on the basis of this, report is prepared. And then you can see from step first to step A1, with the help of cloud system internet connectivity, analytics is done and audits is done in the cloud platform. So on the right side, you can see in the step number B1, chest X-rays are transferred to the cloud system with the help of internet connectivity in the server. And in step B2, various audits and analytics based on the locations, heat maps, age, gender analytics, reports and storage notifications are done. So you can see in the right lower side the different graphs for different statistics. So model performance accuracy as per WHO recommendation, a minimum sensitivity of 0.9 and a specificity of 0.7 is required for community screening for tuberculosis test screening through artificial intelligence. So here our team has found that accuracy was around 0.92, sensitivity 0.90, specificity around 0.93, and other values. TB model accuracy metrics you can see in this graph. So performance summary is based on 90%, 1% of suspects are captured about and captured. So, and around 9% who skipped for this, they are lost for this diagnosis screening. So compared to radiologist screening, about 2x samples can be sent for finally for gene expert. So gene expert is another technology which is done, which is for early for diagnosis based on the real-time PCR. It is based like like for COVID-19, this RT-PCR tests are performed. Both of them are based on PCR technology, TB and COVID-19. So benefit is affordable technology. Chest X-ray would cost around 60 rupees. CMIA test means culture of the cost around 100 rupees. Culture of the sputum culture for TB patients. Gene expert cost around 900 or maybe more than in private pathology labs or RNTCP labs, around 2000 rupees also. Percentage cases CMIA test refer to gene expert, 30%. They suppose if we found 100 samples or test from CMIA then finally they are confirmed by gene expert. 30% cases are confirmed. And percentage cases AI screening refers to gene experts. So here you can see in the tables that only 11% cases are sent to gene expert, and the type of the TB and whether the bacteria, mycobacteria is resistant or sensitive towards the particular antibiotics or not. So here is the advantage of artificial intelligence compared to CMIA test. The settings, you can see that when X-ray screening is not available in resource constraint areas where pathology labs are not available, where hospitals and nursing homes are not available. So cost is around 370 rupees. When the this chest X-ray screening is available, the cost would be of around 159 rupees. Now come to the next slide. So Friends for International TB Relief. So our partner has deep tech software was evaluated by Friends for International TB Relief, Vietnam in August 2020 last year. And out of 11 competitors, deep tech models and did remarkably well and matched expert radiologist performance and satisfied turning test for algorithm development. So you can see here the statistics of different softwares and AUC and percentage confidence interval time in right side compared to true positive rate and sensitivity of this test. So sensitivity you can see in lower table for expert radiologists 95%, specificity 40%, and then further you can see here then it is for it is equivalent to this artificial intelligence, it is which is equivalent to this. So now come to the next slide. So here on the basis of these things, hospital imaging centers end-to-end platform. It provides end-to-end platform using the PAC workstations, hospitals, and primary health care centers, then mobile X-ray beams in right side. So workflow, how does it work? Workflows with WhatsApps and SMS notification. The cloud system is integrated with reports and through web-based systems, it is integrated with different connected with different physicians, clinicians, or radiologists and patients also, and finally administrative department or management team of the hospital. So you can see this pathology prediction, smart reporting, cognitive research, analytics, automated triaging, and self-learning AI engine. So these three things are well connected with WhatsApp, and then reports are generated on the basis of these WhatsApp messages or SMS notifications. Finally, the final reports can also be generated with the help of cloud system in the form of PDFs and different statistical analysis, and these reports are shared to all stakeholders. Now come to the next slide. So how we can leverage artificial intelligence technology in different hospitals and imaging centers. You can see here this figure with the help of pathology prediction, automated triaging, smart reporting, cognitive research, analytics, self-learning, artificial intelligence engine. This way we can do. And finally, the radiologist. So here is the A solution work list for this different name of the different patients, and then TB suspects. Out of these TB suspects pathology, then patient's name, the study state, birth date, and on the basis of these things. So pathology prediction is done on the basis of anonymous data and modules. So you can see the statistics and points where this artificial intelligence works at pneumonia and different pathological pathophysiology, and different reports are generated on the basis of this pathophysiology of chest X-rays. So here you can see these two chest X-rays. They were taking a different time period. So pneumonia was pneumonia. You can see right side 86%, consolidation 80%, and then patient was both of these patients were different. So you can see here this the patient pneumonia again in different cities, portable, chest X-rays was performed. So here is the right side. You will find the findings on the basis of algorithm, which is generated using dense opacity without, which is generated with the help of these different pathological investigations and inputs given by algorithm of artificial intelligence engine. So dense opacity without volume loss findings for this chest X-ray you can see in this right side. In right upper zone with fewer areas, few areas of air bronchogram, multiple pulmonary nodule in right upper and left mid flank. The module shows evidence of calcifications. So these terms both can be easily understood by either by pharmacist or healthcare worker or clinicians. So original study you can see in right side with the help of artificial intelligence in the mid part of this slide. The AI results can be shown here with the help of this artificial intelligence. We can generate smart reports, and then finally the radiologist final report is confirmed by radiologist. So here you can see different analytics for pathology by study uploaded on the platform, gender wise. So on the basis of different parameters, we can do large screening and in for not only for tuberculosis but also for this pandemic COVID-19 and or also for some other diseases also. Depends on the particular geographical region where the particular disease is available or highly prevalent. So this way we can generate data. Here you can see the data was generated for TB tuberculosis studies in old and recent studies and other studies. And on the basis of male and female gender-wise study was performed in these slides. So domain shift, you can see a common machine learning problem. It's a quite common problem in machine learning. So imaging characteristics vary from one hospital to another due to differences in equipment. Obviously, the accuracy may vary for different equipments or instruments which are available, diagnostic apparatus from different companies and different organizations. Equipment image settings, patient positions also may vary. Also, it depends on the patient position, image settings also, and also the way of taking chest X-rays by technician, X-ray technician. Even in one hospital, they may vary from over the time. So domain shifts occur when the distribution of images used for training a model does not match the distribution of model encounters when deployed. We use the following methods to detect such a variation: anomaly detection algorithm, one class SVM, isolation forest, convolution, variations, auto anecdotes, and adversarial methods. So these four methods are used for to detect such a variation in machine learning, which is quite common. Expert in the loop model quickly tunes the artificial intelligence model to the local sources, cohorts, ensures uncompromised accuracies always. So these things this way we perform. So now I have already shown this slide for this tuberculosis. The similar model is was adopted for current COVID-19 pandemic, artificial intelligence. In the same way, with the help of radiologist, with the help of COVID-19 artificial intelligence model, and you can see when we start from smaller phase 1 to phase 2 and then phase 3. So in advanced phase, the 5% scans are audited by screen radiologists. And these things or AI will process within few seconds. So radiologist feedback will be available within 1 to 2 hours of the scan. So you can imagine how this that means turnaround time can be customized as per the requirements and as per the severity of the disease. So key differentiators are end-to-end systems, not just AI models, and for uncompromised accuracy, is expert in the loop model, and for servicing 70% plus hospitals proving track reports till date. So there is a vast market size for screening or diagnosis, developing new novel diagnostics for COVID-19 as well as for tuberculosis. As presently existing WHO standard diagnostic methods, they are time consuming. Well, either they are time consuming, like sputum culture is gold standard as per WHO for TB. but it takes time. So early diagnostic tools, specifically for artificial intelligence, are required using chest X-rays. So there is a vast market, around 10 million people. They are tested for tuberculosis per year. Out of these 10 million, 3 million people, they are skipped through for diagnosis. And in India, around 7 to 10 people, if we diagnose 7 to 10 people, out of these 7 to 10 people, one case is diagnosed for tuberculosis. So if we have to cover 18.9 million people, we have to cover entire country. In our entire country means Indian entire population in India, then we shall have to do these things. We have to target 18.9 million people diagnosed every 3 months. Annual market potential is also very high for sputum based test and non-sputum based test in 4 high burden countries like India, Brazil, China, and South Africa. So for sputum based test and non-sputum based test means extrapulmonary tuberculosis. It's around 35 to 51 billion Indian rupees respectively. Apart from this, global tuberculosis diagnostic market is very high. It was, you can see the growth or trajectory from 2016 to 2021. It was earlier, it was 2.22 billion US dollar, and expected is $2.6 billion in 2021. And it is expected after 5 years, in by 2025, it could be around 3.32 billion as a compounded annual growth of around 4.5%. So here we can see that due to COVID pandemics, a lot of TB patients which are already having TB infection. So if they were working outside their hometown, so due to COVID crisis, they return back into their home, and they are not taking their treatments at this moment. And most of the patients, they have skipped, they are not properly diagnosed, and there is no management available. And that means, I mean to say that they have, most of the patients, they have, uh, they are not taking their treatment. Their treatment is not continuous at this moment. So finally, if they left this treatment due to COVID crisis, these TB patients are to be to start their treatment immediately. Otherwise, the drug resistant tuberculosis after some time will be generated, will be converted. This TB will be converted into drug resistance. Drug resistance maybe multi-drug resistance, maybe extensive drug resistance, maybe total drug resistance. So total drug resistance TB means now no out of these 12 to 16 antibiotics, nothing works for TB patients. And so this is quite dangerous. This is available in our country also. So, so further, it is expected due to COVID crisis, due to discontinuation of this COVID TB treatment, it further it is expected the TB prevalence or number of TB cases will be increased, and these TB patients will work as a hidden carrier, and then they will infect the new population, naive population who are healthy. And then finally, it is expected that we have. So this is an alarming due to COVID crisis. Not only tuberculosis, but some other diseases will also be increased in country. So these things have to be done. So I will like to show one video. You can see this video. Sorry.
Focuses on AIDS detection for tuberculosis powered by a human expert. Typically has to wait for a couple of hours to get a report. In this period, it's likely that they will not be opted for a follow-up or
Excuse me, sir. I think video is not playing.
An X-ray is either a gate solution screens all tuberculosis cases in less than 5 seconds, thereby saving time significantly. Suspected tuberculosis patients can be subjected to an additional clinical test or RTP. Is scarce and costly resources such as RT-PCR can be used only on triage patients who show AI evidence of tuberculosis. Key differentiators for the automated screen.
Video is not being seen on the main screen.
It's not even screen.
Yes, sir. Video is not playing.
Also screen for both objects, plural. Suspected tuberculosis patients or scarce cost resources such as RT-PCR.
So this video is not running.
No, sir. It's not visible.
Just a moment. Let me try again.
The sound is there, but video is not there.
Now you can see.
No, sir.
Sorry.
No, sir. No.
No, sir.
It's not working.
No, not visible.
Okay, there is some problem.
Yeah, actually, if you like to share, then sir, you can show it through YouTube or just play it on your screen.
Okay.
Because in PPT, I think PPT mode, it can't be visual.
Yeah. I can show this video through this YouTube, but the problem is that directly can be shown in through this
Yeah, directly you can show in your
screen.
Windows Media Player or VLC player.
Now you can see.
1.3 billion people.
No, sir. No.
No,
It's
sir.
not.
Not visible.
No. So you first stop sharing this PPT and then play the
Screening.
video. Yeah, then play the video and share on screen.
So now, yeah.
Now you can start video and then share it on this Zoom.
Yes, just a moment. Now you can see. Just a moment. It's not coming.
No, sir.
No, sir.
Now you share on Zoom, sir. Now share. After playing the video, you share the screen on Zoom, sir.
Yes. Actually, there is some technical glitch.
Maybe possible, sir.
Now it should work now. It's work.
Yes.
Now you can see.
No, sir.
It's not showing.
No, sir.
No, sir.
Oh. It's not showing. come here. नहीं वो तो आ रहा है. No, fine. No, fine. Now you can say.
Yes, sir. Now it's visible.
It's coming or not?
Yes, sir.
Yes,
Yes,
sir.
sir.
Now it's come.
In a regular process, after doing an X-ray, the patient typically has to wait for a couple of hours to get refilled. In this period, it's likely that they will not be an option for a follow-up or even end up infecting more people. How does the Yankee screening tool help? The moment an X-ray is done, either in a hospital or mobile van operated remotely, will be guaranteed. Yankees HPV screens all tuberculosis cases in less than 5 seconds, thereby saving time significantly. Suspected tuberculosis patients can be subjected to additional clinical tests or RT-PCR investigation. Scarce and costly resources such as RT-PCR populations show AI evidence of diagnosis. Key differentiators from AI also screen for lung cancers, pleural calcification, or lung cancer, triage additional units or equipment with radiology team. It also empowers care management with smart alert features. This ensures patients receive quick reports, end-to-end workflow planning with an expert radiologist delivery ensures accuracy and effective population health. This brings us one step closer to democratizing healthcare diagnostics, implemented to assist efforts of government organizations, individuals, and corporations fighting this scourge on the face of the earth and assist the global vision of tuberculosis elimination.
Okay, so we are about to finish this. Let me share once again this slide presentation. Thank you so much, audience. Thank you so much.
Thank you, sir. Thank you so much.
You're welcome.
If anybody is having any query, they can write in the chat box so that we can discuss it. Or they can ask the question, whatever question they have. Anybody is having any query or question?
You can unmute yourself and then you can ask the question. If someone is having any question regarding this related to this topic, you can ask questions.
It seems that most of the participants, Ashish, they got exhausted. This is the last lecture.
Yes, sir. Actually, they are attending
Hello.
since last 5 years.
Yeah.
Hello.
Yes, please. Yeah.
Sir, good afternoon.
Good afternoon.
Sir, this is Sanjay Misra.
Yes, most welcome.
Actually, my question is, sir, I want to know is can machine as and deep learning helps us for finding medicine for COVID-19, sir? Already you
So
told us about the application of artificial intelligence for screening of tuberculosis and COVID-19, sir.
yes,
So in the same way, can the machine and deep learning process can helps for finding the medicine of COVID-19, sir?
at this moment, actually, most of the this artificial intelligence is being used for diagnostic purpose. But we can correlate the more findings once we so always a diagnostic is developed, and after the treatment is started. So diagnostic is the first step, and then treatment is the second step for any particular disease. So maybe in near future it would be helpful to collab different softwares, unlike different softwares in medicinal chemistry and then some pharmacometrics parameters, they can be clubbed. Then it's a very good question. Then we can go ahead for theranostic approach for using the artificial intelligence. But
Okay,
at
sir.
this moment, so far my knowledge, I'm not aware about this.
Okay, thank you, sir.
Yeah, thank you.
Okay.
Any other having any query? Anybody is having any query? Anybody is having any query or question they can ask?
So I think, madam,
Yes, sir.
all of the participants as well as uh, sir has provided a very deep and very good knowledge in relation to TB and COVID-19. I am sure, sir, and I wish that you and your team will get a wonderful success in finding this solution of COVID-19. And
Thank you, Ashish. Actually, we are also new for this. Being a pharmaceutical guy, you can understand that
yes, sir.
entry into a pure deep learning, or what we can say, this artificial intelligence, it's not easier.
Yes,
And
sir.
also, since we are engaged in multiple activities, so we have to spare our time. But the technology, since the competition is going ahead, and there is worldwide competition, and there is a most utmost or entire need of these things. So anyhow, we have to takes some time to learn all these things, new diagnostic tools. And before this, artificial intelligence, machine learning courses are being provided by different organizations free of cost through the this virtual mode, conferencing and seminars and tutorials. So thank you so much, Ashish, and your team, and Priyanka, for your time. And thank you so much for all participants who gave us. I can understand that it's not easier to keep stand in a screen for long, more than 5 hours per day. If we are physically attending any lecture or seminar conferences, comparative to in virtual mode, we got more adjusted comparative to physical presence or physically attendance. So hopefully after COVID pandemic, we would be able to deliver all these things, and
Yes, sir.
again we will meet.
Definitely, sir. We will meet physically, and
Yeah,
um, hopefully it will be very soon.
yeah, yeah.
so,
So hope for the best.
so
Okay, thank you
thank you
so much.
very much, sir, and best of luck for your future.
Yeah,
And
yeah, thank you.
now I request, madam, please wind up the today's session. And
Okay, sir.
yes,
So
So,
Ashish, should I leave?
yeah, sure, sir. Thank you very much,
Thank you,
sir.
thank you.
so the session for today is complete now. Here, I would like to thank all the resource persons of the day and all the participants involved in the program. Thank you so much. The next session for tomorrow will be started on sharp 10:15 a.m. tomorrow. I request all the participants to kindly join us back through the same link tomorrow morning. Till then, have a nice day. Stay